All right, everybody, once again, a very warm welcome to the session 3 of our emotional freedom technique. Some of you are watching these videos completely as a recording because you've not been able to attend the live sessions. And some of you have been attending them. So either way, it's great. All that I want you all to know is that we will be having a follow-up, which will be after the 18th of September. And I will be giving the dates on the group chat. So we will have enough time so that you can block your calendars. Do be present for follow-up, because follow-up will not just be for addressing your doubts and concerns. Of course, we will do that, but we will also be doing something which is going to be something new. There's always so much to learn in EFT, and there is always so much that I can share. So you will also learn something new. So do make your time for the follow-up as well, right? Having said that, so far we have covered the technique quite extensively. We have understood the technique. We talked about the emotions. We talked about the importance of dealing with emotions and how emotions get anchored in the body, and they create a lot of our illnesses and our dis-ease, so to say. Then yesterday we talked about the physical symptoms, right? In the continuation of that, I'm just going to mute some of you because there is going to be a background noise otherwise. In continuation of that, I'm going to be talking about insomnia today, which Judith reminded us, and it'll be interesting because a lot of issues come up with insomnia every now and then for us. And secondly, I'm going to be teaching you something which is called visualizing the tapping, surrogate tapping, and some extra points of tapping, right? Which is very interesting. I didn't teach you in the beginning, because sometimes we get a bit overwhelmed with the techniques and too many points can confuse us. With tapping, always know that when you are learning, we learn all the points together, right? We learn all the points. But as you're getting deeper into the practice, and we understand that sometimes life happens to all of us, like Anjana has had a tooth extraction today. Now, obviously, she can't be tapping around her mouth because it's going to hurt her. So please always be mindful that we are very careful. If you've had an eye surgery, if you've had a cataract surgery, or if you've had a trauma somewhere on the face, somewhere in the, if you suppose you've got a frozen shoulder and you feel that you're not able to lift up your shoulders and you can't tap here, so please don't struggle, right? And having said frozen shoulder, I've worked with a lot of clients and patients with frozen shoulders, so it really works really well. So you can pick up now, having learned some points, you can pick up specific points and tap only there. You don't need to ideally tap everywhere, all points. But sometimes, like, for example, like Anjana's situation, if she can't tap in this part, she can still tap on the collarbone. So pick up one point also and you can tap there. That will also help you, right? A lot of times, this is used for people who are very stressed and anxious. And that's what we are going to be discussing in detail today. We're going to be today discussing the mental health. So when you're, suppose that you're going for an interview, right? And you are feeling very stressed and you're not able to tap openly, you can just go to the toilet and just tap on certain points, or you could just be waiting for your turn to be called out for the interview. And you could tap on certain points that are very indiscreet. Like you could tap on your collarbone point. You can, if you're tapping on the karate chop point, not many people can see you tapping that. In addition to that, I want to tell you some more points today that we can tap on. These are called finger points, right? So these are the points which are where the nail and the skin combine, right? So there is this joint where we have got the nail and the skin coming together. So we take two fingers and we tap literally at that junction. So that's the junction we tap at, like it's the junction of the nail and the skin here. We tap on the thumb, we tap on the index finger, we tap on the middle finger. We leave the ring finger. Typically, we are asked to leave the ring finger and we tap on the index, on the little finger, the pinky, right? So I'm just waiting for Mr. Kataria to join. Mr. Kataria, we are just discussing some points, some new points for tapping. And what I just mentioned, I'll very quickly repeat because it's literally been a minute since we started. We said that sometimes we can't tap on all the points, though I highly recommend you tap on all the points. But suppose you've had a cataract surgery or you've had a dental surgery, suppose you've had something around your eyebrows or around your head, you can't tap certain points there. then you can just tap points which you are possibly easy for you to tap. You can just tap on the collarbone point, or you can just tap on the karate chop point. So depending on your life situation. The new points that we are learning today are finger points. So the point where the nail and the thumb come together, we use 2 fingers, but not, instead of doing, typically how do we tap? We tap the tips of the fingers, right? This is how we tap. But on finger points, we use this motion. Please have a look at me. We use this motion, right? So this is at the junction of the nail and the nail bed, literally the skin. We tap on the thumb, we tap on the index finger, we tap on the middle finger. We usually leave the ring finger down, and we tap on the little finger. Now, you may ask me, why do we leave the ring finger out? Now, we don't really know logically why we do that, but the people who have done extensive research and who have studied this modality typically have said that you can leave the ring finger out. That's why we do that. So when you're doing the protocol, suppose you're doing the full tapping, you can do everywhere. You can, so typically when we do the setup statement, we do 3 times here, we say the setup statement, we keep tapping here. Then we tap here, we go on all the points, we go here, we go under the arms, and we go on top of the head. And this is the way the rounds repeat. After every 2-3 rounds, you can also come down to the finger points, right? And we can tap the finger points. That's also fine. There are certain points which now we know are very quick and very powerful EFT points, right? And they say that these points, when we tap on, also things release very quickly. One of the points is here, this point on the wrist. You can tap here. This is also a very discrete point. So suppose you're going for a meeting, or you're going for a court case, or you're going to some place where you're feeling very ruffled. You could just tap here. Nobody can see you tapping here. This point is very powerful. Okay. Then there is a point which is, yeah.
Sorry to interject, Dr. Nupur. Is it left side or?
Both. You can tap on both sides. These points are usually bilateral. So whether you tap right or hand on left or left on the right, doesn't matter. Both sides, the points are very powerful.
And also on the wrist, which side, where the thumb side, where the thumb is?
No, doesn't matter. Doesn't matter. This entire portion, this portion.
Okay, got it. Thanks.
Yes, Mr. Kataria.
Yeah, 2 fingers or 4 fingers?
Doesn't matter. 2 or 4, whatever. Yeah. And then there's another point, which is again very powerful, is at the back of your head. So if you go down your crown, right at the back, I'm going to turn around for you all to see. Could you see that? Because if I speak, you won't be able to hear. It is literally where your skull goes down and it meets your neck. So just above that, there's a slight notch. So somewhere around there. Now, this is also a very powerful point. Then around your foot,
Tip of fingers?
Sorry?
Tip of fingers or what? How do we tap?
You can tap with your hands, doesn't matter. The larger the surface area, the more you can use. You can use your tip of the finger, you can use your hand. It doesn't matter.
Okay.
Right? You can use there. And very soon you will find your favorite points. You will come to know, oh, when I tap here, it works the best for me. So be open to experimenting, which are your favorite points. Now, these are very powerful points because these are where a lot of our channels and stuff kind of come together. That's why these points are considered to be very powerful. Now, the third point in that series is on your foot. If you go down your foot, you'll see there is a bony projection just above your ankle on the outer side.
Yeah.
Right? So that bony projection just above your heel. Right? So that side is also a very powerful point to tap on. It's a foot point.
So it is right, above your ankle or on the right side where you have the jutting bone?
Yeah, that bone. So exactly that part. It's the bone that juts out right above your foot on both the sides, just above your heel. There is a bony projection.
Jutting out.
Yeah, so just that one little bone. I can send you a picture on the WhatsApp group. It's quite simple. There's only one bone that juts out right above your heel on the outer side of the foot. Not the inner side of the foot. Inner side also there's a bone, but we tap on the outer side. Now these points are not for you to get confused. If none of these points resonate with you, please stick to the simple protocol. The easier, the better. But I would like you to know these points. That's why I tell you. Sometimes you could be just sitting and you could just feel a little nervous. You could just tap on your foot and see how that helps. Now, understand that EFT is fairly a new modality, but we are very lucky. We have a lot of research in EFT. So, there is so much research that has gone on in EFT, and it is now a evidence-based modality. We have evidence that this works. Because we have evidence that this works, that's why it's being used a lot in hospitals and other clinical settings. It is used for war veterans. It is used, and we can measure cortisol. We are doing fMRI studies. Also, this is a progressive modality. That means people are still researching a lot of things about it. That's how these new points are coming into our awareness. More and more people are figuring out new points. But as I said, if it's complicated, stick to the basics and stick to the simple. That works beautifully well, right? Now I want you to understand, what do you understand by tapping through imagination? A lot of times you will not be able to tap in a situation because it feels awkward, right? In that case, you can just imagine that you are tapping. You can sit and you could be standing somewhere and you could just imagine that you're tapping. In your imagination, bring up those points and imagine that you're tapping. Now, this kind of tapping can actually work during insomnia episodes when you are awake at night time. Suppose all of a sudden you are awake at night and you're feeling you're in that stage where you're neither awake nor asleep, and you would want yourself to be not distracted. So sometimes actual tapping can feel like, oh God, I'm getting more and more awake because I'm tapping. I don't want to get distracted. I want to still be on the bed and I just want to try and fall asleep. In that case, I would say try visualizing tapping on different points, right? Visualization is a very important tool. I have taught that in many of my workshops, that the power of visualization. So even when you visualize, those channels apparently get activated. And I have done a lot of visualization tapping and it really works for me. And a lot of my clients and patients have benefited from it. So I hope that you can do that. Now, second thing with insomnia is, I would suggest and recommend tapping during the daytime. Okay. Not necessarily just before bedtime. If you can do, that's great, but tap during daytime as well with insomnia. And with insomnia, you keep saying the phrase, this inability to sleep, or however your sleep disturbance is. For some of us, it may not be complete wakefulness. For some of us, it could be sleeping disturbed, waking up after 4 hours or 5 hours, or having a light sleep. Depending on your challenge, say that and tap the challenge out first. In the EFT, we are always facing the problem head on. So this inability to sleep and this inability to sleep well at night, this problem of waking up through the sleep, having a light sleep, or not being able to sleep peacefully and deeply for more than 3 hours. Whatever your issue is, keep saying that and keep tapping, right? A lot of times what happens is we don't know the trigger and we don't know what could have led to this problem. Yeah. In that case, after doing just few rounds with the challenge, we say, whatever may have led to me losing my sleep, I don't know what I might have lost my sleep over. Because see, what's happening in insomnia, you're losing sleep. And haven't we heard of this common saying that you may lose your sleep over small issues in life? I lose my sleep over work. I lose my sleep over finances. I lose my sleep over somebody passing on. So you just say these things, that whatever may have led to me losing my sleep, any issues that are creating this challenge that I may not be aware of, I am ready to let go of them. Any traumas, any past traumas, any past incidents, any emotional upheaval that I may have faced, that may have created this imbalance in my sleep, I am ready to let go of these today. Fully releasing them from my body, from my mind, from my memory. And it's okay for me to release it fully now. So first few rounds are on the problem, inability to sleep, lack of sleep, fully tap it out for 5-6 rounds. Then go and say whatever may have caused me to lose my sleep over this. It could be a physical issue, it could be a trauma, it could be an emotional challenge. Then you trap many rounds for that. Then you say, with insomnia, with problems with sleep, you also say things like, now the problem with a lot of times people who are struggling to sleep, the harder they try, the more difficult it becomes. It's ironical, right? So say this out. The harder I try, the more difficult it's becoming. So I let go of the need to try hard. I let go of the need to make this happen. I let go of the desperation. I relax. I am ready to relax, and I'm ready to let go. And the more I relax, the easier it is for my body to fall asleep. The easier it is for my body to relax. And I am grateful for my body to relax deeply. I let go. So in insomnia, a very key thing is to tap out the worry about inability to sleep. So always understand one thing, right? Whatever challenge we have, there are certain emotions, there are certain traumas that trigger that cause that problem. And then because of the problem, we have further emotions, right? I'll repeat that. And this is a very important point to understand. Suppose you have a challenge. Suppose you have insomnia, for example. Something may have caused it to happen. We don't know what. Sometimes we don't know. With insomnia, it's such a vague thing. We don't know what could have happened. Remind me to talk about if you know what is the trigger. Okay, we will come to that later. But going by the assumption, we don't know what is the trigger. So you tap out unknowns. I don't know what caused this, but I'm ready to let it go. Whatever emotions caused it, traumas caused it, or physical situations caused it. Now, because you have had insomnia for a few days, you also have some emotions. Emotions of fear. Oh my God, what if I don't fall asleep? Emotions of irritability. Emotions of panic. So now you also tap out the emotions because of insomnia, the emotion that you're feeling. So even though I feel this fear all the time, worried about, oh, what if I'm not able to sleep? Even though I have this deep irritability and all the time I'm thinking about this. So tap out that also. Is this clear? So we tap both aspects, the cause, unknown cause, and also the effect of the challenge that's happening in the body, right? And this is something you all must understand, that every challenge that we have is creating a sense of further emotional challenges for us. So we always tap out those emotional challenges as well, right? Now, second thing I wanted to talk about was if the cause is known. Suppose we have had a childhood trauma, or suppose, for example, I was tapping with this gentleman who's a 55-year-old gentleman. He is quite senior in his company. He was molested as a child because he stayed in a hostel. He was staying in a hostel and he was molested as a child. Now, he must have been 10, 12 years old when he got molested. Very, very badly physically abused. Now, this gentleman kind of had put a veil, because a lot of times our subconscious mind blocks that challenge. It blocks it because it doesn't want us to remember that. You know, because if we remember it, we feel very overwhelmed with emotions, because now you can't do anything about it, but still that trauma lingers. Now, literally, this person had forgotten about it. We call it the veiling. It had veiled in his experience. Now, when we started tapping, all of a sudden it became very clear that when he was very young, he felt this abuse, right? And now what we were doing, we actually know the cause, what may have caused this. So now what was happening was, we were tapping as if that trauma was happening right now. All the emotions that were coming for that trauma, all the fears that were coming up, this abuse, this sense of violation, we are tapping it now, right now, as if it's happening. So understand something, that even though an incident may have happened many years ago, our body, our subconscious mind doesn't know time. It just knows feelings and emotions. So you tap in the moment as if it's happening right now, because it's feeling so raw right now. It's feeling so real. And you release it as if you're going through it right now. Right? So we started tapping, and obviously we had to do 3 to 5 sessions of tapping, but eventually he made peace with that. Eventually, that did not trigger anymore for him, right? So understand that if the cause of any challenge is known, then tap from the event as if it is happening right now, and release that trauma, release that memory, and only keep from that memory what you wish to keep. So for this person, it was the sense that I am not that anymore. Nobody can violate me anymore. I am confident and I can take care of myself. So I am this adult. Somewhere he had to tell himself that that part of his life is over and doesn't have to keep remembering that. It doesn't have to impact him at such deep levels. And the more he started taking back charge, sense of confidence and comfort and protectiveness for him, he was fine, right? So this is important to understand. So we have just covered deeply about insomnia. We talked about visualization. Before I go into surrogate tapping, are there any questions so far?
What if you had this mini trauma, but then, you don't know what it probably would have caused? I mean, what challenge it would have resulted, because you have a lot of challenges, but we don't know whether that trauma led to any of these problems. Then how do
so if you know the challenge, if you know the situation, you start by saying, even though I have experienced this experience, whatever your experience is, I deeply and completely love, honor, and accept myself. And whatever that trauma was, suppose it was a mini accident. Suppose, I'm just giving hypothetically, this accident that led to this fear. One of my clients had an accident, and she didn't even have an accident. She got a panic call that her daughter has fallen off in the play field. And she had to drive to the school. And in that fear, she fell in a ditch. The car went into a ditch. And from that day onwards, what happened was that the daughter was fine, but because of this fear, she wasn't able to drive, because she had associated this driving with a traumatic memory and a fear of losing her daughter, because they said it's a head injury. Now you can just think back of that time and keep tapping this fear, this accident, this falling off into the ditch. So you can keep saying whatever the trauma is feeling like, and say the emotions. And once you have felt it, you can even say this, Divya, I have logged this trauma in my body for a very long time. I have logged the traumatic memories in my subconscious mind, in my emotional energy field for a very long time. I see this now and I'm ready to release it now, right? For traumatic events, it's very important to say the release. I am ready to release it. I'm ready to release it from all parts of my being. I'm ready to release it even from my resistant parts. A lot of times with trauma, what happens is, and traumas can be of various kinds, trauma victims, suppose they don't want to let go of the incident because they feel so strongly that the perpetrator did not get punished. Whoever instilled, sometimes as children, when people go through abuse, a lot of times it's from a family member, and they would never tell anybody. So that person could be walking away freely in the society, never getting punished for the crime they committed. But this little child is carrying this anger against this person, that how could this person be walking away freely and not getting punished, right? So you understand the nuances of a trauma. I want you to tap out all the nuances, the fears, the emotions, the physical aspect, the mental aspect, the stress aspect, and tell yourself the fact that even though this happened 10 years ago, 5 years ago, 20 years ago, I'm ready to release it now. And as I'm releasing it, it is releasing from my entire timeline. It is releasing from my past. It is releasing from the roots. Always release from the roots and release from the past. Yeah. And it has no power over me now. This trauma has no power over me now. I am free. I choose to be free, and I am free. Keep saying this. Freedom is very important. Never forget emotional freedom technique. I am free of this challenge now, and I'm very grateful. We may not have time for gratitude tapping, but I'm going to send you a recording of just the way I sent you an overwhelmed recording. Every now and then till we meet for the follow-up, I'll keep either sharing recordings by me or by my teachers. Some of my teachers I have learned it from. I will keep sending you resources. So I am not the only person that I want you to learn from. Learn from everybody. I'll give you some very, very good teachers which are present. They have a lot of videos online, right? So I want you to understand the technique. I want you to know that you can create your own scripts and then you can tap things up. Yeah. Divya, does that answer your question?
Yes, doctor. Thanks.
Okay. What happens if you do not know or remember the trauma? Then you say any trauma hidden, buried in my subconscious mind that I may have forgotten. I'm ready to release that now. Any hidden trauma, any hidden incident. And it could be something, you can even say something that I may have carried on with me through lifetimes. If you believe in reincarnation, if you believe that we are soul, we are energy, and I'm not even going there yet, but I respect, we all have our beliefs and faiths. If you believe that you are an energy that is crossing from timeline to timeline, souls and lifetimes, then you can even include something as big as this challenge, which it may have roots in any of my past lives. I'm ready to release it now. Yeah. So you can say known or unknown, this unknown, any unknown fear, any unknown emotion, any unknown incident that my subconscious has forgotten, but it's still creating an impact now. Anything unknown in this challenge that I can't see or remember, I am ready to release it. I am fully ready to release everything, 100% from my subconscious mind, conscious mind, from my energy body. Understand that there are only few areas from where you can release. You can release from your subconscious, you can release from your conscious mind, you can release from your cellular memory, because all our cells have memory. You release from your muscular memory, you release from your organs, you release from your DNA, and you release from the energy channels that we talked about. So these are some key areas from which you release, right? And I release it now. I am free, I am free, I am free. Do many rounds of release and do many rounds of healing and feeling good about that. Okay. And I'll take the next question by Kalyani ji, and then I'll come to gratitude tapping and the anxiety tapping. Yes, please go ahead, unmute yourself. You are muted, so please unmute yourself. Still unmuted, still muted, sorry. You're still muted, we can't hear you.
Hello.
Yeah.
Hello.
Hello.
Hello. What is happening is you just mentioned, I now clearly remember this particular thing, that as a child, when you didn't even know anything, the memory was not formed, or the sex ideology was not formed. At that time, some uncles in the house, just because they wanted to release themselves, they tried using your body,
Okay.
that kind of a feeling somewhere has awakened. And I do remember after that, I started hating my own body, feeling that I should not be good looking, I should not be very nice, and all those things. I still remember it really actually came into this feeling really bad about it. But I mean, nothing happened really. But I mean, you were used to
Yes.
as outlet. So this is what, and then I don't remember what were the feelings at that time, but it was eeks, like, generally that kind of a feeling that, so I want you to give me some kind of this on this, because you start hating your own body, you start feeling that why am I so good looking, so that even as a child, somebody wants to make use and all those. I mean, these kinds of things really worry you. They don't go away and they remain hidden, as you said. Your conscious and subconscious doesn't want to remember that. So maybe you turn into a fat person, or maybe, I don't know, you start hating men, even that, likewise. Yeah. So
Yeah, thank you for sharing that. I know it's not easy thing to share, and thank you, because this is important for us to share this. It's a big problem, and you have experienced this. So all that I can say that is, I'll do my best to share a script with you all on this. But don't wait for me to share it, because I do have a training coming up, and that's why I'm going to be slightly underground from Monday till 18th of September, 15th, 16th of September at least. But I am still going to do my best. Now, you work with what you know, right? So you still can work with these emotions, this emotion of disgust, the fact that I was used, this anger towards what happened to me. Please give voice to, so literally as you were speaking to me, you could have kept tapping, and allow your feelings to be fully genuine, and keep saying, I release this feeling of disgust, this feeling of violation, this feeling of being violated as a young child, and this little girl who didn't know what she was going through, but this deep sense of disgust and this deep sense of being used. I am ready to let go of this. And I realized that I was not at fault here. This was not my fault. I am not responsible. I free myself from this burden, from this disgust. So as and when you are saying these things, you keep tapping, right? And I'll try my best to create something for you and send it as well. Always know that whenever we are tapping for one individual, as I said in the first session, we could do something called borrowing benefits. So if I'm sending out a recording, and it may not feel that it's my issue at all, but still tap along, you'll be amazed at how much gets released unknowingly also, right? When we are tapping. So Kalyaniji, thank you so much for sharing that, and I'll do my best to do something. But as I said, don't wait, still keep tapping along that thing. Yeah. I want to share something before we get into mental aspect of the EFT today. Though we have been touching upon it a lot, but still we will go slightly more into details of stress and anxiety and sadness. Surrogate tapping. Now, this is another tapping technique which I want all of you to understand what that means. Surrogate tapping. Surrogate tapping is something which you can tap for somebody else. Yeah. So suppose a loved one is going through a challenge, right? So you can tap on their body. You can tap for them on their body, or you can actually say to yourself that I am tapping for so-and-so person on my body. I am this person. So you can imagine that you are that person and you're tapping for them, or you can tap on their body while they're experiencing it. Now, a lot of times people who don't understand the world of energetics wonder, how can I call myself as somebody else and tap? But this is something that happens all the time. We have seen that when people who are very closely related, when one individual has a problem, the other person also gets the problem. You know, so we are energetically very, very connected, much more connected than we think we are. Right? And understanding, if you have taken any of my workshops and master classes on energy and vibrations, I always say that we are more energy than matter. So by that logic, I want you to understand that you can declare that you are tapping for anybody else. So suppose somebody but I would still suggest that at least till we finish the follow-up, refrain from surrogate tapping. First, master it completely for yourself, on yourself. Let's finish the follow-up session. And after that, you can go and venture into surrogate tapping. But if suppose you're in a crisis situation, right? Suppose a loved one has to be rushed to A&E, to a hospital, and they're in pain, right? You can actually either tap on their body, saying, releasing this pain, releasing this pain, releasing whatever, or you can actually tap on yourself saying, I am so and so, I declare that I'm tapping for them, for their benefit. And once you finish tapping, you just say, I am releasing this person from my energy. I am myself now. I'm fully me, right? So you can do both the ways. A lot of times this is done by a lot of people, especially, and very commonly it's done for people who have cancer. I teach this technique to the loved ones of people who are terminally ill in hospices, who are going through a very, very bad patch and they can't do it on them. Then I tell them, if you have very elderly parents, like 80, 85, 90 plus parents who are not very cognitively sound, the many 90-year-olds I know are very active, but if they are not, then you can actually tap on their body with these points, right? Tap on their body physically, or you can just say, I am this person, tap fully, and then declare that I'm back in my body and I am who I am. The process, the tapping and everything remains exactly the same, but it's just that you're doing it for another person. Yeah, that's what is called surrogate tapping. So even if you go online and Google it, or if you're looking it up, now you know what we mean by surrogate tapping and how it can be done. A lot of times with infants, they have a lot of colicky pain. So I was visiting one of my cousins in India when I was there, and this child was having a lot of crying because of colicky pain. I actually tapped on that infant. The child was just 9 months old, and there was instant relief. There was instant relief, right? So just simple things. You're very lovingly, you're tapping on somebody, very lovingly you tap, right? Very gently you tap. And you keep tap wherever you possibly can, right? And that's how we work with surrogate tapping. Any questions with surrogate tapping? Any doubts? We're all clear. Brilliant. So any questions from last night? Anybody did anything with the physical pain, physical discomfort? Any tapping happened there? Anybody tried overwhelm tapping, though I just sent it, I know it didn't have much time. Anybody managed to do any tapping in the morning for anything unrelated to what we discussed? Yeah.
Overwhelming tapping I did just before joining the call.
Okay.
So didn't have time to assimilate much because I finished it, and by the time the call had started.
Okay. And
so after that, I felt a pressure here, like some throbbing, like it was not a pain, but a sensation over here. So I think maybe because of the focus of, bringing those emotions, I'm not sure.
Yeah, and this may happen often when you're tapping, some sensations will come up. And when the sensations come up and they're unpleasant sensations, what you can say is, whatever has led to this feeling of pressure, I release this pressure. I release this pressure. I let go of this tension and this pressure in my head, in my forehead. So keep releasing that. And you can just keep releasing till you feel better.
Sure.
Anybody else who tried tapping in general for anything today morning? Anybody who has been experimenting? Yeah, Gunjan, please go ahead.
So I tried tapping for acidity today morning. So I was having some burning sensation when I tried it. And
Gunjan, I can't really hear you very well. Sorry. Can you just?
Can you hear me now? Am I
loud
enough?
Yeah. Much better.
Yeah. So was having some burning sensation, and urtic area was starting to erupt, and it was causing me discomfort. So I thought, let me just try. So I tried tapping, even though I did it in the car while traveling to office, so I couldn't utter it loudly, but I did it in my mind and I kept tapping. So yes, I did feel relief. The burning sensation went down and the urtic area didn't come throughout the day. So it did help.
That's huge. That's huge. Now, I want you to continue tapping. Now, when I say don't jump issues, this is a classical example that please keep tapping for your gastritis, your acidity and your urticaria at least for a week. At least for a week, I want you to become so regimented, like how you would have a shower every day, how you would brush your teeth every day. I want you to commit to yourself, I will tap for this problem every day, right?
Okay.
A lot of times, also when we have some health challenges, we have a sense of ownership. We say, this is my acidity, this is my insomnia, this is my knee pain. I want you all to let go of this ownership. Let go, it's no longer yours. Just start saying, this acidity that comes once in a while, this acidity that I have been experiencing, for some time, I'm letting go of it from roots. So it's also very important to start disowning your challenges. The more we disown, the more we start to free ourselves from those challenges. So don't take ownership, right? So like even with, no matter the more chronic the issue becomes, it kind of starts to become our identity. We almost label ourselves as this person. So be very careful, Gunjan, and this goes true for all of us, that please don't own any disease, own any condition. Know that it's just a label and it can be released, right? Also, when it comes to certain conditions we experience, people tell us, for this, so you will have to take medication for the rest of your life. This problem needs to be, there's nothing much can be done. And this may be something that you may be experiencing or somebody in your family, loved ones. Always know that you don't have to believe that. So, you know, sometimes I was especially working with this person who had chronic fatigue syndrome. And with chronic fatigue syndrome, it's again something which of unknown origin. But the doctors had told this person that you will have to take this medication for the rest of your life and it will never be, you'll never be fine. Now understand that this mentality will not help us. So you need to release the belief. So release the belief behind your problem. I let go of the belief that this cannot be overcome. I let go of any limiting beliefs. I let go of all the limiting beliefs. A lot of times we are told as children, you are not good enough. No matter how hard you try, this you cannot do. This is not you. So I want you to start releasing these limiting beliefs. EFT is very powerful to let go of all the limiting beliefs. So any limiting belief that is creating this. So Gunjan, though you did it in the car, you did it kind of a indirect EFT where you were not speaking out aloud, but you were still tapping. You can also do visualization, that sometimes when you can't tap, you can just visualize those points, right? And just in your visualization, imagine you're tapping and you're saying things. That's what we have done. But I want you to please be very regular with this. Know that you can release this issue fully. And the more you do it with conviction. I'm ready to release this fully from my body. I have had enough of it. I'm ready to experience this. So do it with conviction. Enough is enough. I really am ready to let go, and I'm healing. I'm ready to heal, and I'm ready to magical and miraculous healing, right? So pushing ourselves is very important with our beliefs. If we believe that we can do it, we can do it. So if a part of you is telling you, Gunjan, maybe you'll be better by 20%, but beyond that, I doubt it. Tap for that. That's resistance speaking, right? So tap for that even though a part of me feels that nothing can be done, I still let go of this part. I'm ready to lovingly bring this part on board. No, this can happen, right? So please, that's why I say EFT has so many nuances. You know, the more you practice, the more you learn, the more you'll understand many aspects of it. So we talked about visualization, we talked about insomnia, we talked about surrogate tapping, we talked about extra points today, many extra points you have learned today of tapping. You can do whatever feels comfortable to you, so you can take those points up. Now we are going to go into the mental health aspect of tapping, right? So I'm going to go back and refer to my notes of mental health challenges. A lot of you said stress. A lot of you said anxiety. Anything that I may have missed here? I'm seeing getting thoughts in the mind space, lots of thoughts. Anxiety, overthinking, procrastination, lack of clarity. Yeah, Divya, go ahead.
This may not be directly linked to this, but I've attended your chakra session also. So it has also the areas and activities and meditation to do, like say for fibroids, Swadhisthana and the related exercises, right? So how do you combine both, or how do you balance it out in terms of the techniques?
Yeah. So with chakra, this a lot of you may not understand. So completely fine if you don't. I had conducted a chakra workshop last month, and chakras are energy centers in the body. Like we have root chakra, we have crown chakra. So certain chakras correspond with certain organ systems and imbalances in the body. Like if you have constipation, if you have piles, if you have hemorrhoids, that's when the root chakra gets affected, deeply impacted. So you can unblock the chakra by doing the tapping. So you can just say that I'm releasing the blocks in this chakra and anything that this chakra may be creating. So with your uterus and fibroids, you can work on the sacral chakra and the solar plexus chakra. So you can harmonize, and also root chakra, because the root is the foundation. Yeah. So root is the foundation of our, sometimes when we are feeling very ungrounded, when we are feeling very insecure in our life, and that's when a lot of challenges start to happen for us. So that's when we do. So you can tap out completely. I had done a follow-up session of tapping with chakras. So just have a look at that. And then you can do that
Sure.
also for yourself. Yeah.
Thanks, Dr.
Any emotional imbalances. Yeah. Okay. I would like to ask you all, typically in mental health, we have things like stress. We have things like anxiety. We have things like overthinking and worrying. Anybody has any typical particular thing that you're experiencing right now or these days that you're feeling overwhelmed by in terms of mental issues, mental health challenges that you would want us to work on? Any anxiety, any stresses? Tell me about whatever.
It should be, it is not for myself, it is for my brother, actually.
No, right now let's stick to you.
Okay, then
Because then that will further complicate the issues. Let's not go to a
Anxiety.
different person right now. Yes, please go ahead, Mr. Jain.
Anxiety, doctor.
Yeah.
Anxiety.
There's a lot of anxiety when I get up in the morning. So, how do I finish my, there's so many pending issues. How do I finish that?
Okay.
So that leads to, that leads to not being able to focus on, on important things. And then some of the time goes waste in just to adjust yourself to kind of bring your focus back on the important things.
Yeah. Okay. Thank you for sharing that. Judith, please go ahead.
You're mute.
Yes, for me, I think it's one of self-doubt and dealing with the setbacks. Although I feel within myself I've got the confidence to do something, if there's a setback, either with a physical symptom or an emotional symptom or something outside of, environmentally, that's it's a setback. I find I don't deal with that very well.
Right. Okay. Perfect. So what we are going to work with today is anxiety. And time permitting, we will cover self-doubt and setbacks. Understand something which I want all of us to really understand here is that we can be facing any challenge. It could be anything. It could be self-doubt. It could be feeling I am not good enough, right? And a lot of times we have this thing that I am not good enough, or you could be a perfectionist and you feel that, no matter how hard you try, you're never satisfied because there is this perfectionism, this streak in you, and you're always second guessing yourself. So self-doubt can be because of many reasons, right? Always understand that when you are releasing a particular state of mind and a particular emotion, always go to what is the foundational feeling behind that. Is the self-doubt because you feel I'm not good enough, or is the self-doubt because you're a perfectionist, right? So, or is there a self-doubt because you feel that somebody has told you that you are not good enough? Because somebody said to you growing up that no matter what you do, you never do it well. So even though a part of you thinks you've done it well, but that old voice always comes to you saying that, oh, are you sure you did it well? Because you never used to do it well. So always find out, and the more you tap, the more you'll understand what is the basis of that challenge. So tap out the root cause. Always go for the root cause in tapping. After doing many rounds, after doing at least 5 to 6 rounds of tapping for a challenge, always focus on what could be the root cause of that. So that's where I want you to shift your focus. Rest of the tapping is same. Once you practice tapping enough, you'll be able to work with any issue, any issue. Absolutely, you'll be amazed at how quickly you'll be able to work with that. But obviously, while we are still learning, I'll do my best to give you as many scripts, either mine or somebody else's, on videos on YouTube. Now, with anxiety, which almost all of us feel at different points with the different intensity. Now, first of all, I want us to start understanding what is this label called anxiety doing to us. I want you to dissect the label. There are certain physical sensations in the body that happen when we get anxious. There are certain emotions that come up, and there are certain thoughts that come up in the mind. So anxiety is a complex of multiple scenarios, situations, and sensations that we label as anxiety. So I want you to now slowly learn to break it down. So break down anxiety and tell me, at the level of body, what do you experience? Suppose you had to tell anxiety to a person who's come from Mars. He's an alien. He doesn't know what the human condition is all about. He doesn't understand anxiety. How will you explain anxiety to this person? What happens that you call anxiety? So break it down and tell me exactly what you feel. And that's how we will tap. So please go ahead. And everybody can share. We'll start with Mr. Jain, and then everybody can share. So,
you become highly irritable.
Okay.
On everything till the time your work gets completed. You simply spoil the whole atmosphere.
Okay. Physically, what's going on with you when you're getting anxious?
You start getting headache. You start getting restless. That is physical part.
The physical part is headache and restless. Now I'll come to everybody because everybody has experienced anxiety. So I want everybody to give me a little bit of what physical sensations they go through when anxiety happens. Yeah,
burning over here, this section.
Okay.
A lot of burning, and then the stomach gets into a knot, like it's bloated. It starts pressing against, it's pressed against your intestinal wall or something like that. That kind of a feeling.
Right. Yeah.
And over here also, the neck, the backside of the neck, that strain, and around the eyes.
Yeah. So it's amazing that our body is telling us that we are anxious. The body feels things. When I used to get anxious, and I still do, I get palpitations, right? My heart starts to beat very fast. And I can almost feel the heart beating against the chest cavity, right? So those are my symptoms. That was Divya's, that was Mr. Jain's. Anybody else can share with me what they feel when they get anxious in the body?
I get confused.
Okay.
And irritable.
Okay.
Almost like a trapped animal sometimes, in the sense that I don't know how to get out of the situation. Yeah.
Amazing. Analogies work really well. Yes, Mr. Kataria, you're unmuted. Please tell me.
Yeah. So basically, I used to get pressure on my temple area.
Yeah. Anybody else?
Yeah, here. I feel like shouting at the other person. Secondly, trembling your body, hands and legs shivering, that kind of sensation.
Yeah. So anxiety, we will be dealing with at the level of physical body, right? All the symptoms and sensations that happen in the body. Very shallow breaths. This is the classical way in which the body is responding to a fear and a threat-based situation. And something that Judith told us was amazing and very powerful. And I want you to all understand and start thinking like that. Analogies. She said she feels like she's trapped. She's like an animal in captivity because she doesn't know how to get out of this. Helplessness. Now, having come to the physical aspect, we come to the emotional aspect. And an emotional aspect would be feeling of helplessness, feeling irritable, right? Feeling like shouting at other people, angry outbursts, right? Now, these are all the emotional symptoms. So, and there'll be a space in the mind, if you can imagine, mind space, constant mental chatter, very confusing thoughts, which are literally like a tape record playing, vicious cycle. Same thoughts are coming up, and that's what gets triggered, right? And now the beauty is that our body learns this association. So every time you start thinking that thought, the body gets into that activity, and then the body gets triggered, more parts of the body get involved, and so it becomes like a vicious loop. You have to break this cycle, right? So I want you to try this tapping next time when the anxiety is coming up. Now, the headaches that you're talking about is when the anxiety is almost quite established and it's been peaking for a few hours, or maybe at least an hour. That's when the headaches will start to happen, right? Before that time, can we interrupt? Understand we have to work, when we work with mental health, we practice something we call pattern interrupt. We must interrupt that pattern as soon as we recognize we are going down that rabbit hole. You all know the way your body gets anxious. Now, that's the reason I asked for physical symptoms. You will quickly pick up, oh my God, I'm getting into the anxious loop. I need to break that pattern. The sooner you break the pattern, the more quickly you'll come out of it. And one of the key ways of breaking the pattern, along with many others, which I teach in my coaching sessions, but today we are focusing on EFT. It's a very powerful pattern interrupt, right? So I'm going to be doing a tapping session on anxiety, where we are going to be focusing on the physical aspect. We are also going to focus on the emotional aspect, and we are going to focus on the mental aspect. I want you all to give a score of anxiety. So I don't know if anybody's feeling anxious right now, but if you are, please, you can do a demo right now with me. But if you're not feeling right now, then we can just imagine an anxious situation, which may have happened very recently. Okay, so that's 8. Anybody else has any anxious situation that may have happened very recently? Give it a score.
Had a question, doctor. This overwhelming and anxiety interrelated, right? Or is it very different?
Overwhelm is a part of anxiety. When you're anxious, you feel overwhelmed.
Okay.
So yeah, and that's a very good question, because that means the overwhelming, the EFT recording, which I've shared with you all, that will also help you in your anxiety reduction in the anxiety levels. Yeah. Give your anxieties a score as much as you can, as best as you can. And some of you have already done that. I'm very happy to hear that Mr. Kataria's scores is 2 or 3, because we have been working on some of the aspects. Very good. This is good news. Okay, so we have certain scores. Very good. Okay. I want us to think, I don't want to create a panic attack for anybody, but think of that anxiety that typically you feel often. Think of a situation that provokes anxiety, and start by just feeling that situation. For Gunjan, it could be even this acidity. A lot of times our health challenges also makes us anxious, right? Inability to sleep could be creating some stress and anxiety. Whatever we are doing today, please know that stress can also be dealt with in the same way. Okay, right. So just take a few moments, close your eyes, and just imagine that stressful situation. You are not there, you are just seeing it on the screen of your mind. But I want you to still feel it, so that you can feel, or you can see how you're feeling at that moment in time. And you're all now feeling a bit irritable, a bit anxious, just by the power of your thought. And that's what anxiety is. Your ability to think stressful situations creates anxiety, things which have not even happened. So first of all, recognize this is the way anxiety starts. And this is what we are trying to grip today. Now open your eyes, please. And let's start. Even though I have this feeling of anxiety and I can feel the stress coming up, I deeply and completely love and accept myself. Even though I have been struggling with anxiety for some time now, and I notice that it really triggers me, I deeply and completely accept myself. I have lived many decades with this anxiety. And this anxiety has been somehow getting worse and worse. And as I acknowledge this, I deeply and completely love and accept myself. Now, coming to the reminder points, tapping from the eyebrow, you can tap from both sides or one side. This feeling of anxiety, feel it in the body. These sensations in my body that cause this anxiety to get escalated. This feeling of tightness in my chest, this restlessness and trembling in my body. And say the symptoms, even if they're not your symptoms, I want you to still say them and say them all out loudly in your spaces. This feeling of knots in my stomach, burning sensation that I feel, this heaviness in my chest, this restlessness in my entire body, this pressure in my temple area, this feeling of being confused and trapped. All of these physical sensations. And now you can be even more specific to what you feel. This tendency to, now we have talked about the physical sensations. I want you to keep tapping with the physical sensations for a few moments. Few rounds, just this racing heart, this beating heart, this pounding heart, this palpitations in my chest. There's almost a feeling of throwing up. A lot of times when you have intense anxiety, you feel like throwing up. This feeling that I'm going to puke. This burning in my stomach. All the physical symptoms and sensations that I experience because of this anxiety. This anxiety. This familiar feeling of being anxious. This feeling of anxious. And now I want you to start, having done a few rounds of the physical sensations, I want you to say the emotions. The sense of helplessness that this anxiety provokes. This feeling of helplessness, worrying about the tasks at hand. So much is there to do, but I can't focus on anything. This helplessness, this irritability, this tendency to shout at others. Almost hyperventilating and overthinking. And now we are from emotions, we are coming to the tendency. This tendency to overthink, to worry about future, a future that has never happened, and a future that's invisible, unknown, worrying about something that I don't even know exists. All this worrying and all this future projection, all this fear. Always know that there is fear always in the mix of anxiety. All this fear. What ifs, all the what ifs. What if, all the unknowns. All the ways in which my mind creates a vicious cycle of thoughts, emotions, and fears and feelings. This tendency to overanalyze, overthink, Worst case scenarios. A lot of times anxiety comes when we imagine worst case scenarios. This tendency in me to imagine the worst case scenario. What if this happens? And what if that happens? Now you have said physical sensations, emotions, and you've also said the way the mind is working in anxiety. Now, having done a few rounds of all of this, I'm going to say we are going to release it, okay? It's now time to release all of this cocktail of physical, emotional, and mental sensations. I let go of all of this. I let go of this tendency to overthink. I let go. I let go of this old habit of me to catastrophize. What do we mean by catastrophizing? Worst case scenario. When we're thinking of the worst case scenario, we catastrophize. That's the word. This tendency in me to catastrophize, I am ready to let go of it. I'm ready to let go of this feeling of tightness in my body, this burning, this headache that I know will come up. It may not come up today. As I'm ready to release all this anxiety from my body, I release it from my mind, I release it from my body, and I release it from my heart, from my cells, and I release all the traces and old habits and loops that have been created because of this anxiety. All the neural pathways that lead up to this anxiety are being now breaking. They are now getting more and more disrupted. I am releasing all this energy from my body, from my cells, from my cellular memory, from my physical memory. It's okay, I am safe. It's okay, I am safe. I am safe. I can breathe, I can relax. I give myself the permission to relax and ease and relax and be at peace. I am fine. I am doing the best that I can do in this moment. And in this moment, the most important thing is for me to be calm and to be at peace. I am calm. I am peace. I am calm. I am peace. Do a few rounds of I am calm, I am peace, I am relaxed. As my mind relaxes, my body relaxes. And the more my body relaxes, more my mind relaxes. And I know that anything that has to be achieved can be achieved from the space of calm relaxation, peace and calm. And just finish the round and then just come down and take 3 deep breaths. Peace and calm. Peace and calm. Breathe in and breathe out from your mouth. Breathe in again. Deep breath in and deeper breath out from the mouth. Feel the body now. And I want you to quietly go to your notebooks and write down a score. And now we'll do one more round. And I'm going to include something what we call the gratitude tapping today so that you can also learn that. And gratitude tapping, I would want you to include in every tapping. From now on, whenever you tap for any issue, always try and finish at least, maybe the first round could be first, maybe if you're doing tapping in the daytime, you don't do gratitude tapping, but try and do at least once a day gratitude tapping. That's a very powerful tapping technique. Okay, even though I have some residual anxiety left in my system, I deeply and completely love and accept myself. Even though there is this knowing, and a part of my mind is saying, oh, how can you get rid of it so quickly? I deeply and completely love and accept myself. Judith, keep saying it loudly. with tapping, we must be able to say it. If you want, just take a sip of water, but I want all your lips to be moving. Even though I have this residual anxiety, because I know this has been my tendency for a long time, but now, from this day onwards, it's becoming lesser and lesser. And as I am working through it, I am confident that I can be in charge. And as I'm doing this, I love and accept myself. Reminder phrase, this residual anxiety, all the remnants of this, the traces of this, keep saying it out aloud, the remnants of it, the traces of this anxiety. This old pattern and this old way of being is no longer compatible with me now. I understand that this anxiety has served its purpose. And a little bit of anxiety has always helped me perform and plan. But I am ready to release all the excessiveness and all this tension that it creates anymore. I can still function, but I do not need anxiety anymore for that. So I'm grateful for having learned this lesson that I am not my anxiety. I am in control of it. I am no longer a captive to it, but I am in charge of it. So from this day onwards, I grow bigger and stronger than the anxiety. And every time I see myself getting anxious, I know I can nip it in the bud. I know I can stop it, and I will do that. I do not need to be anxious to perform well. I do not need to be anxious to do well, to plan well. This was an old belief, and I'm releasing it now. I can be calm and quiet and still achieve. And perhaps achieve a lot better than I have. And from this day onwards, I choose peace and calm and relaxation. And the more relaxed I am, the better I accomplish. And the more calm I am, the better my mind functions. And the more relaxed I am, more intuitive I am. And I allow my intuitive powers to help me perform to the best of my abilities. And I am grateful. Now we come to gratitude tapping. I am grateful for this realization. I am so grateful. Now you may not feel that much has shifted, but still do gratitude. Because the more you practice gratitude, the more shifts will happen. So we say, I'm very grateful to my body for healing. I'm very grateful for my body for relaxing. I am so grateful for my mind, my subconscious mind, for allowing me to relax. And I'm very grateful for this opportunity to realize that I am bigger and greater than the anxiety, that I am in charge. I'm so grateful to have gone through these experiences to know that I no longer need them in my life. They no longer trap me. I am grateful for this healing. I'm grateful for this realization. I am so grateful that I'm becoming stronger and more peaceful, that I am becoming more in charge. Thank you. I'm so grateful for my body as it starts to calm down now. My stomach is relaxing. My head muscles are relaxing. My temple muscles are relaxing. All parts of my body are relaxing, and I'm so grateful for my body. I'm so grateful for my mind. And I'm so grateful for this ability to work through this. And even if anxiety strikes, I know it's nothing to be worried about. I don't have to become anxious of becoming anxious. I no longer become anxious of becoming anxious. It can come and it can pass away. And I do not have to get involved. I'm stronger and I'm positive. And so it is. Thank you. Just do 1 or 2 rounds of thank you tapping. Thank you. I'm so thankful and I'm so grateful and I'm so thankful and I'm so grateful. Thank you. Thank you. Thank you. Just finish that round. Whenever you're ready, put your hands down. Take 3 deep breaths. Feel the peace. Feel the calm. Now go back to your notebooks and write down how you feel. And one more thing you can add when you're doing anxiety tapping is that I understand that the situations outside may not change, or the person outside may not change. But the more calmer I am, the better I am at handling those situations and that person. Because always know that anxiety is triggered either by a situation, a person, or by our thoughts projecting into the future. So your mind will trick you, but nothing has changed on the outside. So how can you be calm? It's dodging yourself. It's like deceiving yourself. But then that part of your mind is what you will say, that the more calm I am, the better I am at handling crisis. A firefighter, a doctor at surgery table, a pilot that's flying a plane, always is trained to be calm in crisis. So you tell yourself, the calmer I am, the better I am at dealing with crisis. And I have this ability in me. Outside doesn't have to change, but the moment I change, everything else feels better, right? So this is another way you can say the statements and tap. Wonderful. So please share your experiences.
It was quite very relaxing. I think the score has come down to almost 2 from 8 when I started it. My voice can tell you that it's much more calmer. And also I'm a student of Brahma Kumari, so they also teach us, your thoughts should create the situation, and not the situation should create your thoughts. So it should not be the other way around. But in actual life, you tend to again get into a trap of this unnecessary overthinking and outside situation try and control you.
Yeah, and that's exactly why I said that line just before we finished.
Right.
That we have to become smarter than our mind. Our mind sometimes is not our best friend. It's a tool, but this tool can a lot of times create unrest. So we have to tell that mind to us that we don't wait for situations to change. We don't wait for that person to change. First, we have to be in that space of calm collectedness. And then when we are in that space, intuition becomes sharper. And for all of us to work and perform, our intuition is what helps us to achieve more. The more quiet and calm we are, the more our intelligence can be put to use, right? So this is the way we start to practice it. So if you feel anxiety is coming up, instead of allowing it to come up, start tapping. And doesn't matter whether you're using the right words, doesn't matter. Even if you just tap this anxiety, this feeling of tightness, that's enough to calm you down. You may not know in that moment what to do, but use it in the moment. EFT is a tool to be practiced in the moment, right? And that's where it also helps to do obviously beforehand, but in the moment, it's also very powerful. Anybody else would like to share how it felt for them? We have done quite an intense 15-minute tapping. How are you all feeling? And slowly unmute yourselves and share.
Yeah, can I share, Dr. Nupur?
Say again, Kunjan.
Yeah, so let me share my experience.
Again,
so
sound.
Yeah, so can you hear me now?
Something you do with your mic, I think it becomes better. Last time it became really well. Yeah.
Better now.
Oh, yes.
Okay, so yeah, so I wasn't feeling anxious when it started, but I then imagined the situation because you asked me to imagine the situation. And yes, so there is a difficult relationship which I have to face time and again, and that causes me a lot of anxiety, and that causes palpitations. And also I realize now that it is another cause of my acidity, because there is rumbling in my stomach and I have this feeling of loose motions. So when we did the tapping, after that, yes, the sensation of that rumbling in the stomach, the sensation to pass motions has gone down completely. So yes, it did help a lot.
Very interesting. Very interesting. Yeah.
So
I'm feeling quite headachy.
Okay. Yeah. So
Yeah.
if you're feeling headachy, you can just tap this heaviness in my head. This heaviness in my head, because it is something that has to be released. Yeah. So just keep tapping a few rounds, Judith, and just keep saying that I release all this heaviness in the head, and drink lots of water. So while I'm speaking to other people, just do a few more rounds, and we'll come back to you in a bit. Yeah. And anytime you feel that you need to take off your glasses, feel free to do it. You can do it with glasses on. You have to be a little more careful. That's all. How was it for you, Mr. Kataria?
It was quite relaxing. I was almost falling off asleep, the last 1 or 2 rounds. It was very, very relaxing for me at this time.
Very good. Very good. Divya, how was it for you?
It got me a little more peaceful. So, well, intensity, I don't know in terms of how much, but then it brought in a lot of wave of calm.
Yeah. And isn't that what we want to achieve with anxiety? It's a complete opposite of being anxious is being calm and relaxed. So that wave of calmness that you're talking about is huge, isn't it?
And I was reflecting that, that pattern break, right? I always defer, any meditation exercise when the anxiety peaks. So I was making a mental note, break the pattern next time.
Yes. Absolutely. We don't wait. It's almost like, we don't wait for things to get worse. We have done that many times. We intervene when things get out of hand. But now with these tools, we start intervening at the first sight of it. Because now we have also learned how to recognize anxiety. When these sensations in the body are happening, now oh, this is going to come down. I'm going to think worse thoughts. I'm going to feel worse, and it's going to get catapulted beyond what it is right now, right? So you start breaking the patterns then and there, right? Kalyani ji, bataiye, how was it for you?
More relaxed.
Yeah. You were able to feel were you given, had you given a score to your anxiety before?
Yes, about again my health issues, which is cancer. So
Yes.
that is what it was. I mean, I'm a cured patient really, but that doctor keeps on telling every time I go for a checkup, something like that. That's what, and every 6 months I have to go through all that. He's saying some blood condition is changing and all that. So that gives you a lot of anxiety. So I just tried on that.
Very good.
It's okay. It's okay even if, and I'm living like that. It's okay, whatever it is. And I'm living very happy.
Yeah. So like not living as a suboptimal life, but living with joy. So, if something is making you sad, please tap for that, and if you're getting anxious before going to the doctor, tap for that anxiety. You could be sitting in the waiting room and you could be tapping. A lot of times, a lot of the patients that because I've been working with cancer patients a lot, they use this technique when they're going for their chemo, when they're going for their radio, when they're going for their follow-ups, because they are so anxious at that moment, nothing can help them at that moment. They just sit and tap. And that's their window of relief, So we have to slowly start increasing our relief as much as we can possibly. Yeah. And as I said, sometimes we will feel worse. Sometimes we will feel headachy like Judith was feeling. And that's all a process of relief, because we have kept these energies trapped for so long, so we will release them. Yeah.
Yeah.
Yes, please go ahead.
How much time should we be doing this tapping, for anything, whatever you explained?
I would say tap till the score comes down, ideally to 0.
No, I'm saying at one time.
Yes, at one time also it can come down to 0. It can come down. So suppose the intensity is at 8, at least tap for it to be 50% less. But eventually, like for Gunjan, I would say, her issues, when sometimes the issues are a little longer, more long term, if she's tapping for acidity, I would tell her that maybe she may feel that in the first instance, the scores, the acidity comes down by 30%. So tap for 15-20 minutes, then keep tapping for 15-20 minutes and keep seeing the scores coming down. Sometimes you would be amazed that in one session, chronic issues have come down to almost 70%, and I've seen that, right? So keep tapping for at least 15 to 20 minutes. Ideally for the scores to come down to 0. If they're not coming down to 0, at least a comfortable level. And you will know intuitively when to stop. Sometimes, you know, when you will stop, you will be in such a zen place that you will be like, you know, for now, I'm actually feeling very good. And I'm fine with it. This much tapping is enough. There is another phenomena which you all should know about: psychological reversal. Psychological reversal in EFT happens a lot because of the power of EFT. A lot of times we feel the mind tells us, how is it possible? This cannot be. I can't get relief so quickly. And you attribute it to the fact that you've got distracted or something else is happening, right? So please understand that your mind is still not your friend. So don't listen to the mind, start listening to your intuitive knowing, inner knowing, the inner mind, the intuitive mind. Because the mind may say, oh, this is too easy and too quick. How can I get rid of it so quickly? You know, so mind is judging it, but the body is actually feeling it, and knowing will come from your heart. So don't go by that thought and keep tapping. And if you are feeling better, acknowledge it. It could be a miraculous recovery. EFT started with a miracle. The story of EFT is that that lady who was Mary was relieved of the phobia of water by just one session of tapping with Dr. Callahan. So EFT is magical. It is miraculous. So don't believe in our problems and challenges to the extent that we own them and we feel, no, nothing can happen. Come from the mindset, I am open to magic and I am open to healing. And healing is my right. I deserve to live happy and healthy. And that's my right. Come from that attitude and tap, so that the shifts will be also faster. And as much as possible, practice gratitude tapping. Practice gratitude even before it happens. Yeah, Judith, we are almost completing now. Right? So understand that gratitude is something that can change things. So be grateful before a thing happens is something that in EFT we practice a lot. So keep saying thank you and keep feeling good, right? So gratitude tapping is something I've just covered. Please practice that also as much as you can. Yeah. So we have 3 intense sessions of physical, mental, and emotional. We have done a lot of things. Please keep revisiting. Please keep doing as much as you can. And we will probably regroup in the week of 18th for a follow-up session, which will be again for 1.5 hours. But till then, I want you to really, really put EFT to good use. Use it regularly, use it in crisis, use it whenever you have pains, you have aches, you have questions. Please put them down on the WhatsApp group. Yeah. And keep practicing, and we will meet for a follow-up. And the reason I'm giving a little bit of a longer gap is because A, I'm on a training, B, I also want you all to practice a lot, right? Yes, please, go ahead.
Doctor, I have one request. All these videos should be all the time live, you know, because they go off and sometimes you are not able to, you know, it says it's private. So there are a lot of things which needs to be resolved very quickly.
So they are working to transition it to a platform called Teachable, and I'm hoping that will happen soon. Till then, I think they will share Google Drive link as well as the YouTube link with you all. So I'm hoping that those links should be fine.
You know, my only request is that it should be with us throughout, because whenever we want to see, we should just go back and see and then again.
Yeah, absolutely. So I believe when we transition to the platform, all these recordings will be there on that also. So it's just, I think it's going to take some time, but for the sessions, you will definitely have the access. If not YouTube, then Google Drive link will be definitely.
You know, for Chakra, for example, I don't have the videos for Chakra. They all vanished.
Yeah. So we will ask Ruchi to look into that and give you again the access of it if it's not there. And once they're on Teachable, then there'll be not a problem. There will be lifetime access, hopefully. So I don't think that should be a big issue.
Because all this chakra and this thing are all interrelated. So we need to, really kind of
Absolutely. No. I'm sure they're all working on it quite intensely at the background. I know.
Can I send this link to my computer? And it will stay there. Can I send this link to my computer and it will remain there?
So yes, the recordings are meant to be accessible to you for forever. So
It's a personal computer. It's not.
Yeah,
So
absolutely they will be. Yeah. So once you have got the recordings, you can watch them. You have any problem, you can reach out to Ruchi and she will resolve that for you. Yeah.
Thank you so much, Doctor. Wonderful.
Thank you, everybody. Thank you.
So just one last thing, I lost 45 minutes of this session, so I'll be able to catch up with the recording.
Yeah. Please have a listen of the recording. Yeah.
Okay.
Thank you, Mr. Ajit Kumar. I hope you have also gained from these things. You haven't shared much. So please keep writing in the chat. And if you have any questions right now, I'll be very happy to answer.
Nothing now.
Okay, thank you. Thank you so much. All right, everybody. Keep tapping and keep sharing your feedback. Any questions? I'm right. Anybody else wants to leave, you can leave. I'll be here for another 5-10 minutes. Any questions, you can stay back.
Thank you so much, Doctor.
Thank you. Thank you. All right then. Thank you, Mr. Kataria. You can anyways contact me if you have any doubts. All right. Bye.